A bit of health now. Did you know that at least 22 women die every day from cervical cancer? Medical experts say the human papilloma virus is fast becoming a threat to women of all ages. They say early screening and vaccination in rural communities will help bring the numbers down. We have more in this report.
According to the HPV Information Center, cervical cancer ranks as the second most frequent cancer among women in Nigeria. It affects at least 12,000 women every year between the ages of 15 and 44. This is the grand finale of 4 Girls and Women Innovation Boot Camp, organized to promote vaccination and screening for cervical cancer across the country. The boot camp is in collaboration with the Nigeria Institute for Medical Research, St. Louis University and University of North Carolina, both in the U.S. Lead fellow of the project and director of research says the program was organized to engage girls and women on the best ways to upskill vaccination and screening for cervical cancer.
So what we've done now is to bring young girls and women, mothers and daughters, into a boot camp to come up with an idea to educate us how best they think we can reach women and young girls for cervical cancer prevention. We want to use research to contribute to elimination of cervical cancer in the country.
Cervical cancer is a scourge. We should not have another woman die. And so if anybody has good ideas, there's so many things we want to do to end the cervical cancer burden, but it would take us working collectively with you. And so we intend to actually win all of them because we know that they are going to communities many people have not heard of.
Experts are advocating that government and other stakeholders put a framework that will encourage early diagnosis and access to affordable treatment.
HPV is all about prevention. Prevention, prevention, prevention. Young girls need to be vaccinated against human papilloma virus, and middle-aged women need to be screened for it so that we can detect it early and prevent cancer. It's a really important disease for prevention. You can have symptoms. Oftentimes women don't have symptoms of cervical cancer, and so when they get diagnosed with it, it's too late.
With human papilloma virus vaccine, you have 98% protection against cervical cancer. And this is the reason why, as an advocate, we engage policymakers to make cervical cancer vaccination, that's the HPV vaccination, part of the national immunization scheme, so that every girl in Nigeria can have the vaccine. Not only girls, even boys, between the ages of 9 to 14 or 15 years.
At the end of the boot, 7 teams emerged winners, as they will go back to the various communities and do a step-down program for 50 girls and 50 women who will receive free HPV vaccine and screening.